Thank you for joining Healthcare Hub. This is Consumers Doctor, Dr. Bengala. Healthcare in general, the delivery of healthcare in a country for the first time in America has surpassed the US defense budget. America spends $3.7 trillion. It spent $3.7 trillion in 2018, still ranks 37th among the most advanced countries in the world. It's not acceptable. That needs to change. After spending that kind of money, we can do a better job of healthcare delivery. I was just listening to Deepak Shetty, a cardiac surgeon who has several hospitals in India, almost 37, and he also has a hospital built in Cayman Island. You should listen to Deepak Shetty, one of his YouTube clippings. I've been posting it. It's amazing. One person could make a difference in healthcare. He does cardiac surgeries, especially in children with holes in their heart. The cost is unbelievable. Cost is $800. He charges roughly under 80,000 rupees, which is almost like under $800 for each surgery. What he's trying to say is, it is not the policymakers, it is not the insurance companies, it is common folks which can make a difference in healthcare. What I'm trying to emphasize is consumers demands, personal responsibility can make a big difference. Ordinarily, these traditional insurance companies, you have to pay high premium no matter irrespective of their age or any pre-existing illnesses. They charge because cost keeps going higher and higher because they're taking care of the burden of the uninsured, burden of having no insurance. It is costing the average folks. The premiums are rising and rising. What we need in America is health care insurance reform. Instead of providing traditional insurance policies for everybody across the spectrum, what they need to do is having $3,000 deductible plan. I know it may sound difficult because for common folks, $3,000 is a lot of money. But government can assist, invest in lower income groups. They can invest. If you really calculate the $3.7 trillion, it's simple math. America has spent $10,000 per person, the entire population. Can you imagine if we can reinvest that $10,000 in ordinary folks? That same $10,000, if you invest in for each person, we can solve the healthcare. We can individually solve the healthcare. What I'm saying is, there has to be health review authority, public-private partnership. Under the public-private partnership, people with the low-income group, people with pre-existing illnesses, people with disabilities, impaired group, this public-private partnership they don't qualify for regular insurance. This health review authority will look at each applicant and can issue certificate of guaranteed coverage. So then the insurance companies have to participate. If they want to survive, they have to participate because that's the only way they can function. Because once insurance reform does, the traditional insurance companies will vanish. All of them have to embrace a deductible plans with a new approach for government giving certificate of guaranteed coverage to ordinary folks. People are making $50,000-$60,000. The employers can subsidize. Employers can subsidize the deductible portion and the health coverage because it is a tax deductible for employers and it's tax deductible for the employees too. It's a win-win for employer and employees and independent businesses, small. We have most of the small scale industries, small group employers can also avail this opportunity to use as a tax deferred investment for their own employees. It makes sense for an employer and employee to have health savings, deductible health plans with health savings. I would rather have health savings accounts than this workman's comp. I am not sure where this workman's comp insurance fits in because I'm a self-employed individual. I have 50 employees under my umbrella. For me, workman's comp is a burden to pay the premium. I would rather invest in my employees and get them traditional insurance. If they get hurt, that insurance will take care of it. I don't see any reason why we need a workman's comp. It is only going to the attorneys. I would rather invest that workman's comp policy towards my employees and get a coverage. I hope ordinary folks understand when the employer gets a traditional like high deductible health insurance policy, what it does, the premium saved is put aside into the health savings account, which you're investing, employer is investing, is employer subsidized. Same thing when it comes to the government subsidized group, so-called Medicaid, Medicare, veterans. Government is subsidizing the healthcare. I would rather have the government invest. We're already getting the Medicare benefits anyway. So I would rather give the consumers the control instead of managed care companies and insurance companies. I would have consumers be given that chance. If they're paying ordinary Medicare, I think Health and Human Services should look into it. They are giving the managed care companies $1,000 to $1,200 every month to take care of the Medicare recipient. I would rather give it to the ordinary folks the same money and they can get the coverage, what they need with the high deductible plans. Whatever the money saved is put aside into the health savings. I don't see any reason why the Medicare has to invest with insurers. I would rather invest with the consumers. That makes a big impact on healthcare delivery. I know Medicare, it's easy for them to just delegate it to the companies, but I would delegate it to the individual consumers. I'm sure Americans are smart enough to take care of their own health. If I was given that same $1,000, $1,100, $1,200 per month, I would put into my savings and I would get a high deductible health catastrophic coverage. Whatever my capabilities are, $5,000, maybe higher premium, so my premiums are lower. I can tolerate 5,000 deductible because I have a health savings account. Same thing with the Medicare recipient gets $1,000. He can get the high deductible health plan. Money saved from that can go into the health savings, which will be used for their own health. Health and Human Service should really look into investing in ordinary folks rather than insurance companies. What's happening by giving the money to these insurance companies? They are basically cutting the service. I've noticed a couple of doctors managing the full risk contracts. They get the full risk premiums and they try to cut the corners. Do you see doesn't make sense, folks? I would rather give that same money to ordinary folks like us to take care of our own and get a high deductible health plan ourselves. Why should we let somebody else manage our health? I hope our president, our Health and Human Service Secretary are listening to this conversation. Medicare recipients should also have high deductible health plan with health savings. They can save lots of money by empowering the consumers, empowering the Medicare. So either the government subsidize, employer it doesn't matter. State subsidize. Invest in your citizens, folks. That's all I'm saying. Invest. If they're spending $10,000, if the American government is spending $10,000 per person, that same money can be put to a good usage by federal and at state level. Invest in ordinary folks. Empower them so they can take care of their own health. If you like this channel, I'll be talking about over and over till somebody gets it. I just can't imagine. It just makes sense for our government to listen to this, listen to its people, listen to the ordinary folks, listen to the people with the impaired group. They should. People with low income category, impaired and disabled, gets a priority. There's no doubt. I would like to see them succeed, but the government should empower them and invest in them so they can get the health coverage what they need. Not the government is telling them. It is what they need. Invest in. The whole video is about invest in ordinary folks, American citizens. That they deserve it. If you like this channel, subscribe to this channel. I'll be keep talking about this. Invest in America. And hit the notification button. Please make some comments. I'll probably be going live, streaming live. Hopefully I'll get a more audience will be listening to this. Again, thank you for joining.